2005. I was a second-year OBGYN resident when Hurricane Katrina hit. In the days leading up to August 29th, I was so busy working such long hours, I didn't even know a hurricane was coming. I spent 9 days trapped inside a hospital in New Orleans. 9 days of not knowing what was going on outside. 9 days of dwindling supplies and rationed food. 9 days of delivering babies while the floodwaters rose. 9 days of taking care of patients who had no idea where they were going to go after they left the hospital. Inside the hospital walls, patients were looking to us for more than just care. They wanted reassurance that everything was going to be okay. And I couldn't provide that. 16 years later, I lived it all over again during Hurricane Ida. Except for this time, I was the physician in charge of making sure that my patients stayed connected to care. I spent hours on the phone, calling, tracking them down, trying to connect them to providers in the areas where they had located so they could continue their prenatal care. Now, I have the privilege of a big network. I can pick up the phone, I can call colleagues across the state, I can even call colleagues in other states. But when privilege is what decides who gets care, that means some women get care while others are left behind. And that's not good enough. That not good enough has driven me since the early days of my career. I now spend my time split between delivering babies in my own community and working as a public health advocate to ensure that all moms in Louisiana have the opportunity to have a good outcome. Now, what I've learned in this process is it's not just one thing that determines your outcome. It's not just your care that you receive. It's not just your health before pregnancy. It's not just the neighborhood you live in. It is all of these things working together. And so I use a Venn diagram to describe the framework for improving maternal health. The first circle is clinical quality of care. The second circle is systems of care. And the third are social conditions, the conditions in which you live, learn, work, play, and raise your families. Now, these are interlocking circles, so when one falls apart, the others do as well. Still, if we want to understand this crisis, we have to look at each more closely. And tonight, the one that I want to focus on is the one that we talk about the least, but is arguably the most important. And that's social conditions. In fact, 80% of clinical outcomes are due to social factors. So in other words, the story of your health is the story of the environment. And few forces impact the environment as much as climate change. And I want to show you 3 ways that climate change is already impacting mothers and babies: extreme heat, displacement from storms, and economic instability. Now, commonly, when we think of climate change, we think about floods, we think about hurricanes, we may even think about wildfires. But one thing that we don't think about is silent but deadly, and that's extreme heat. In 2023, Louisiana had 64 days of extreme heat. That means 2.5 months when just being outside was dangerous. And for pregnant women, the stakes are even higher. Extreme heat raises the risk of a preterm birth by 16%. And Louisiana, we rank 51st for our preterm birth rate. Year after year, we have received a failing grade, a grade F, from the March of Dimes for our preterm birth rate. And for Black babies, the risk is 1.5 times higher. Now, imagine you're 7 months pregnant. You're working outside in the heat, or you're working in a warehouse with no air conditioning, and your only relief is to come home to an apartment with windows that don't open. This isn't just uncomfortable. This is dangerous. Now, storms. Now, Louisiana, we know storms. Katrina, Rita, Ida, Laura, Gustav, the storms keep coming stronger and stronger. But each time the playbook is the same for pregnant women. Medical records are lost, medications are stopped, and prenatal care stops. That's not just inconvenient, that's dangerous. When prenatal care stops, that means that problems are missed, risks rise, and lives are lost. Now, economic instability. This exacerbates climate change. Far too many Louisianans live at or below the poverty range. And more than most of us are one paycheck away, one disaster away from filing for bankruptcy. Of all of the social drivers of health, I think economic instability is the most decisive because when you don't have money, you don't have choice. You don't have choice to evacuate. You don't have choice of what you're going to eat. You may not have choice to continue your care. And for pregnant women, the stress of that economic instability raises blood pressures and it causes premature labor. Now, what do we do with all of this? I'm not here to say that my ideas are going to solve climate change. But what I am here to say is that pregnant women deserve to be protected through climate change. Not just some women, but all women. And in order for that to happen, we need activation from three groups: policymakers, providers, and our patients. Policymakers. Policy is where the system begins. Yet, pregnant women are rarely written into climate action plans. This has to change. We need protection for workers in the heat. We need for our pregnant women to be prioritized when we have cooling zones. If we're planning for transportation in rural areas, we need to think about our pregnant patients and raise the minimum wage to a living wage. No one should have to make a choice between health care and food, and especially our pregnant women. Now, moving to our providers. Providers, it's our responsibility to make sure that our patients are connected to care. That means when we're planning for disasters, it's not just about generators in the hospital, but it's about creating systems so that when our patients evacuate, there are providers waiting with their medical records to take care of them. For this to happen, we have to reach across state lines and set up safety net systems for our patients to be able to continue the care. We need to make sure that when the storms come, that care doesn't stop. Patients and community. Our patients need the tools so that they can navigate climate change. That means knowing where cooling zones are. That means working with their providers, working with their community to know where to evacuate, where they can have care continue, and to understand what their medical problems are so that they can have a healthy pregnancy. Now, when we think about all of these things, I go back to remembering how privilege cannot be the way that we decide who gets care and who doesn't get care. And you may be saying, I am not a woman, nor am I pregnant, so what does this have to do with me? The truth of the matter is that the health of our mothers and the health of our babies, this is the truest reflection of the health of our society. That means it is a problem for all of us. So the next time that you hear somebody say something about climate change, I want you to ask, what about the moms and what about the babies? Thank you.